What's going on, everyone? We are here with another, what do you want to call this, an update episode on Behind the Counter, where with everything going on, actually it's ironic, we had planned to do a couple hot topic episodes and have some we wanted to talk about, and then sure enough, all this stuff hit, and we have a lot of hot topics that we can talk about and keep everyone informed about, just ready-made, and we are, yes, breaking the social distancing rules for the short duration of this episode. But you want to give us like kind of an overview of where we are right now in terms of...
Absolutely. The COVID-19 coronavirus mutate, it's been actually global news since December. Unfortunately, it kind of got to us starting late last month.
Right.
Or beginning of March, really. So, past few weeks, it's been so many different things happened, right? I mean, I certainly did not expect us to be wearing masks or gloves right now.
We've got some tape up in the pharmacy. Yep. We've got a bubble at the counter in the pharmacy, too.
We are doing whatever we can do in order to protect the community and also our staff as well, so we can stay here and help everybody.
Right. I think that's the important thing to mention, right? Like, we are, there are people in our community with it now. There are people who we are helping who have coronavirus now.
Absolutely.
And I know, like, there have been some people who've come into the pharmacy and, we have some tape up and the bubble up and they see us in masks and they kind of freak out because we closed off some of the aisles and, we're having our staff shop OTC for our patients. If we do that, more curbside pickup delivery. Some people have kind of, it can be alarming, and I understand where they're coming from. It's, it's alarming to see, a place you've been coming to for years and all of a sudden it's like, oh my God, what's going on? Like, are they infected? Or this kind of stuff?
Are we infected?
Right, exactly.
And luckily, as of now, none of us came up positive.
The vast majority of patients that I've helped, though, honestly have thanked us and appreciated us for taking these measures. Because if you think about it, right, like in any retail store, someone could come in and sneeze on something or cough on something, and then they, walk away, pay for their thing, leave the store, whatever they do. And then the next second, you're coming up there and unsuspectingly you pick up, whatever they had, especially if it's a popular product right now. I would say gloves or masks, but those obviously you can't get anywhere. But, trying to do something like that. And then now all of a sudden, next thing you know, you have it on your hands and then you touch your face, touch your eyes, whatever. And then there you go. Now you're infected too. And that's the scary, terrifying thing about it, which is why we've taken some extreme measures, at least in here, because we feel like it's our responsibility to be as safe as possible here so we can keep our community as safe as possible. Because if we get infected, if we get sick, then it's going to be very difficult to help other people.
Right. Is it too much? We've gotten some of those questions. Now, as Vince mentioned, let's just say Tylenol, such a hot topic right now. Everybody's trying to get their hands on Tylenol. Someone comes to the pharmacy and they sneeze, as you said, or cough, or even talk, because all the droplet can come from anywhere, as long as it comes from your mouth, right?
Right.
And then, as of right now, this virus can survive on surface area possibly up to 3 days. That's a lot.
Yeah.
I mean, now, just because it survives for 3 days doesn't necessarily mean that you'll catch it.
Right.
But then again, there is always a small chance.
Right.
Hence, we actually restricted all of our over-the-counter product from our customers, and if any of us, our customers, need a product, ask one of us and we bring it to them.
Right. And you brought up the Tylenol as well, so just to give an update, because we get questions every single day. Do you have masks? Do you have Tylenol? Do you have gloves? Do you have hand sanitizer?
Sure.
So masks and gloves we're working on, we are, trying to do the best we can with that. They're out of stock everywhere. As far as for acetaminophen, which is the active ingredient in Tylenol, and hand sanitizer, per the New Jersey Board of Pharmacy, because we're a compounding pharmacy, we can actually make some of that here, given the fact that this whole crisis is going on to try to help the community. So we actually do have Tylenol, or not Tylenol, I should say, acetaminophen, that we have compounded, regular strength and extra strength. It's available only with a consultation from the pharmacist behind the counter. So if you need any of that, please call us and ask, and we can talk you through that. And hopefully next week we'll have some hand sanitizer as well. As soon as we get the alcohol in to actually make the hand sanitizer, we'll be able to provide that for you guys again soon too.
Absolutely. Now a little behind the story on the Tylenol or acetaminophen. WHO did claim that, God forbid, if you are infected with COVID-19, one of a very common symptom is high fever. Now, in different countries, they're actually trying not to use ibuprofen or any of the NSAIDs to lower those fever. They're actually preferring to use acetaminophen. Hence the reason everybody's asking for acetaminophen, because God forbid if you spike with yourself with a fever all of a sudden, so you can start taking them right away, and then obviously contact the state. As of right now, there's a hotline that you can call, or even call us, and we can certainly direct you to where to call as well, to hopefully to stay safe and lower the symptoms as best as possible.
So, at a state level now for New Jersey, we've got the quarantine going on.
Yep.
Places are shut down. Have you heard anything going on about the testing sites, or do you know anything about that?
I know there was a couple of testing sites that were open. I believe near us there was one in Paramus that has been open, but they actually closed down after 2 hours because there's just alarming number of people.
Yeah.
It's a drive-through, and there's an alarming number of people just trying to get tested.
Sure.
It just can't be handled at the moment. At the same time, FDA is trying to approve more testing kits so that it's more easily accessible. The people are definitely getting tested. The way we know that is, number one, well, unfortunately now, United States has the most positive confirmed cases in the world. I mean, that's certainly can seem pretty alarming, but at the same time...
And New Jersey and New York are the top two in the states, which, given our population density, makes sense.
Right. The chances are they're already here.
Yeah.
Now, finally, more and more testings are being done, and more stats are showing up as well. So that's probably the right way of approaching this, by looking at it. So with the testing sites, with the testing itself, unless you are actually contacted, someone came out positive, or you actually have active symptoms, or you travel to any of the different countries that are hot sites, such as Italy, China, and so on. Those are the people that to be recommended on testing. And the way we see it, hopefully, as this testing gets more readily available, the strict guideline hopefully gets less strict, and then we get to test many people as much as possible. Right. But it's it's getting there.
For sure, but it's putting a huge strain on the healthcare system, which is literally the entire concept behind the whole flatten the curve thing.
Right. It is. So number one thing is, if you are feeling sick, stay home. Yeah. And call. You can use phone calls now. You have internet. You can get all the access everywhere to it now, right? Call first for possible symptoms. I have these symptoms. Is it possible they can be COVID-19? And then now I know a lot of doctors are doing this thing called teledoc, which is you don't have to go to the office.
or whatever. Yeah, and phone call at the very least, even
over the phone they can try to diagnose you and then prescribe you medications. And now the prescription can certainly come through e-scripts or by computer. So when we get these prescriptions by computer, and again, we can do curbside pickup at our pharmacy, or we would certainly drive it down to right to your house as well.
Right. We've added delivery people. We're delivering a ton now, specifically so we can help you guys stay home and respect the quarantine and keep everyone safer too. Yeah, I mean, this is crazy. I don't know when the end will be. Do you have an opinion on that, or have you read anything about the...
Well, in my personal opinion, based on other countries that already went through this, China, South Korea, right now Italy is another one as well, France, another one that's rising up, Germany rising up as well, it's gonna get worse than better. Right. So, I know there are numerous different timelines out there right now, given by the government, given by different healthcare professionals, but overall, it's only gonna take slight, down south a bit for more now. So, at least hopefully, just for a couple more weeks. Or it might be a month or even longer. And at the same time, we're also hoping as the weather gets warmer, that these viruses, hopefully, and again, kind of fade away as well. So there are many different variables with this.
I've read conflicting information on that, because like Florida, and all that kind of stuff.
There is certain conflicting stories on it, but it's one of the positive hope that we can look for. But major thing is social distance. I know we're definitely bringing that right now, but it's at 6 feet. It's important.
Respect the quarantine. Stay home as much as possible. If you have to go out, do your business. Avoid contact as much as possible. Wash your hands, sanitize when you're done being out, even if you touched a couple boxes at the grocery store, and go home.
Wash your hands. I mean, I'm sure everybody talks about washing your hands. And even if you're at a grocery store now, I know the chances are you probably will get infected in grocery store because there's so many
The
people
grocery
going
store
in.
by where I live just put on the door the other day that they have a case in one of their employees.
Absolutely.
So
and
apparently they shut down, did a whole deep clean, and now they're back open, I guess. But
yeah, and you know, they're trying to limit the amount of people actually walking into the store.
Right.
But the major thing is this. While you're waiting to go into the store, make sure you keep that distance of 6 feet while you're in line.
Right.
You know, you don't have to be one right after the other. And that's one of the major things that I have seen, unfortunately. People are just clumped up together, waiting for the store to open or letting you in. Take a step back. It's all worthless if you get infected while you're there. And let me mind you, coronavirus, COVID-19 is highly transmittable.
Right.
It is a pandemic for a reason. I mean, if it wasn't as crazy as we would think it to be, it wouldn't really be here and we wouldn't be doing this.
Right.
So it is very serious. And one more thing that I really want to mention, and we've been saying this numerous times in our past episodes as well about COVID-19, just because you're young doesn't necessarily mean that you won't get it.
Right.
It's highly, the chances are right now, chances are you'll get it, and chances are you probably have mild symptoms. But the important thing is you can actually transmit to someone else who is immunocompromised or who's just elderly. I know our customers at least half of our customers are elderly customers, and whenever they walk in, we do our best so that they are safe as well. And one of the major reasons we are wearing these masks so that we don't transmit to them. God forbid if we have it. So there are some cases now, unfortunately, not trying to alarm anybody, but even if you're young, middle 20s, 30s, 40s, there is something called cytokine storm that's been happening that's caused by coronavirus and actually leading to death, even in young age. So, and yes, that's very small cases. However, it is possible. So make sure, try not to go out, stay home, and again, respect the quarantine.
Right, for sure. One more thing I wanted to mention too, in case you guys are interested, we, at the pharmacy, we sold out of vitamin C, zinc, any kind of like your typical immune support products very quickly. Even our Gaspar's Best line, we had zinc lozenges, those were gone, and we're trying to get more back in stock, but we're on kind of allocation with that. A bunch of our orthomolecular products that are more popular as well for immune support have been out of stock, but we do have a bunch of those back in stock now too. So if you have any questions or are looking for more immune support supplementation or any of that kind of stuff, please visit our website at gasparsbest.com and you can check them out there, or just give us a call at the pharmacy at 201-997-2010 and we'd be happy to talk you through it and help you out.
Just with the vitamins as well, yes, I'm sure there are many different things that we hear about the treatment versions of these virus, but besides from that, in other countries, they are using high level of vitamin C, zinc, and so forth. Well, what quercetin. You would normally, quercetin, and supplements are actually being used as a treatment guide, so it's not, so definitely protecting ourselves by boosting our immune system is the #1 thing that we can do right now as well, along with everything else that we're already doing. And certainly visit us or call us, ask us about it. And I've been getting common questions about elderberry, which is another common immune support. There's a mixed opinions on that. Right now, with that, if you're already on it, I don't see why you should not be on it. But theoretically, the cytokine storm that I mentioned is a possibility with taking elderberry, but it's just all theoretical at this point. So just be careful. Do not drink a whole bottle. And that actually has been happening. Taking too much is not always a good thing either. As long as you're taking within the doses, I'm not too concerned. But if you have any other questions or concerns about what you can do to support yourself, support your immune system, please let us know.
Absolutely. Keep fighting the good fight, everyone. We will keep fighting the good fight on our end as well and being responsible with how we're taking care of our facilities here so we can help you stay safe and be safe for you and your family. That's what we're here for. Any questions, like James said, please reach out, and we'll see you on the next episode. Thanks. Stay safe.